Hi friends, welcome to the video. In today's video, we'll see how diabetes can affect your vision and how to protect eyes from diabetes. Diabetic retinopathy is a leading cause of preventable blindness. Globally, the prevalence of diabetic retinopathy is around 27%. Diabetes can cause damage to the eyes and over time cause vision loss and blindness. Hence, if detected early, we can prevent them from getting worse. Diabetes can cause multi-organ damage and hence it is very important to keep your blood sugar in control for overall health. And efficient diabetes management not only helps in preventing diabetic retinopathy but also helps in other eye disorders namely cataract and glaucoma. Let us have a look of the retina of the normal eyes and the eyes which has got diabetic retinopathy. In the first picture, we are seeing a normal healthy eyes where the blood vessels are very healthy, and in the second picture, this is a eye which has been affected by the diabetic retinopathy. The red color spot which you are seeing now is a bleeding inside the eyes due to damaged blood vessels. The symptoms of diabetic retinopathy are black spots, floaters, which are seen as moving cobweb-like structures, blurred vision, and they also complain of vision fluctuation, like they see sometimes clearly and at times they don't see vision clearly. Retinopathy, the blood vessel inside the eye weakens, and in initial stages called the non-proliferative stage, the blood vessel leak in retina causes hemorrhage, fluid and lipid deposits in the retina, which eventually impairs the blood flow. And as the disease advances, an abnormal response of growth of new vessels are formed, which further leaks in the vitreous gel and causes the detachment of retina, causing blindness. Who are at risk of developing diabetic retinopathy? People with uncontrolled blood sugar or people who have got diabetes for a long period of time are at risk of developing this diabetic retinopathy. Along with it, a person who has already got hypertension and high cholesterol levels in the blood are also at increased risk of developing this diabetic retinopathy. Studies have shown that this diabetic retinopathy worsens in pregnant females who has got diabetes. So it is very essential to keep your blood sugar under control during your pregnancy period in order to prevent the worsening of this existing condition. The other risk factor is smoking. Smoking also is known to cause worsening of this diabetic retinopathy condition. Let us see the stages of diabetic retinopathy. In stage 1, microaneurysm, which is the local disturbance of blood vessel happens. Stage 2, the blood flow to the retina gets affected. In stage 3, there's a severe loss of blood flow to the retina. In stage 4, a new abnormal blood vessel develops which eventually bleeds inside the eye and causes retinal detachments, which eventually causes blindness of the eyes. This is the initial stage of this condition where the patient will not have any symptoms. So, keeping your blood sugar under control in this stage will help to regress or prevent the further worsening of this condition. If you're going to ignore your blood sugar control in this stage, it will progress to the next condition where the new blood vessels forms and bleeds inside the eye and causes other complicated conditions. The initial treatment are the intravitreal injections and retinal lasers to prevent the further damage. So how can we prevent this diabetic retinopathy? Follow this to keep your health on track. Number 1, take the medicines as given by the doctor. Number 2, maintain a healthy weight. Number 3, add more physical activity. Number 4, keep your blood parameters under control, which is the HbA1c, blood pressure and the cholesterol levels. And number 5, please quit the smoking habit. Your life and your vision are the most precious gift from God, and protecting them is in your hands. I hope you liked the video. If you like my video, kindly like, share and subscribe.